spent over 10 years in higher education in the workforce, focusing on wellness and healthcare. And here's what I learned. Wellness and healthcare are interconnected, interdependent. There's no one without the other. And to truly understand both, I'll break down both. So wellness, I believe wellness could be broken down into 3 parts, even 4. So the 3 parts are nutrition, fitness, and mental health. You could also add a spiritual portion. So nutrition is literally medicine for the body. And the closer we stick to our intended food, natural, less processed, the better we will do. And a lot of things are linked, a lot of diseases are linked to nutrition. Now, the fitness portion too. Fitness is very important. I used to do observation hours in rehab facilities, and you can tell, I could tell who worked out when they were younger and who didn't. You know, there were older people in there, some that could move great, some couldn't. And I'm like, wow, everybody should intend to get older. And when you get older, do you want to be not able to get up and move or not? So it's an investment. You got to work out now while you can. And even if you're older and you can't, still get that movement in, and that will help. Start stretching, start walking, will help your health. Now 3, the mental health portion. I've done interviews with multiple therapists, and here's what I've learned. When we focus on the bad, we get more bad. And when we focus on the good, we get more. And so our mental health dictates everything in our life. If your mind isn't right, your life won't be right. So this is a very key portion. Now, how wellness connects to healthcare, right? When you don't eat right, when you don't eat right, when you don't exercise, you have a higher chance of ending up in the hospital. Of course, you know, healthcare is unique because everyone will experience healthcare in some point of their life, right? We all get sick, we all get injured, and things happen, right? So we have to do our best to prevent, you know, do our part, eat right, exercise, things like that. And of course, there's diseases and things that people can't control that you were born with, or just some rare disease, but I'm not talking about those. And so healthcare is very unique. As I said, everyone will use it, but most people don't understand it. Right? You have to understand all the components of healthcare, right? Healthcare, the healthcare facility, the doctors, the insurance companies, the policy making. When I first got into healthcare, I didn't understand the impact of how much policy has on healthcare, right? It dictates literally almost everything that is done in healthcare. You know, it's like for the insurance company, it dictates what can be billed and certain amounts and different things. And you have to know all the parts, because if you don't understand all the parts, then you are just living your healthcare experience by default. And we all assume that, you know, someone will show us the right way, right? But that's how you could get taken advantage. So this is a simplified version, but just know that if you're taking notes, prevention is key to wellness. And if you do find yourself in a healthcare situation, understand all the components. Understand your health insurance. Understand your, you know, what to ask your doctor, billing, regulatory things. And this channel's here to make it simple for you. So if you do find yourself in a healthcare situation, you know how to navigate it. I'll see you later. Have a great rest of your day.